Tuesday is World Maternal Mental Health Day. Joining us this morning is psychiatrist Nancy Byatt from UMass Chan Medical School. Thank you so much for being here with us this morning. This is such an important topic. What are some of the more common mental health challenges that women experience when they're pregnant or postpartum?
So mood and anxiety disorders are very common during pregnancy and the postpartum period. 1 in 5 individuals will experience depression or anxiety or another mood or anxiety disorder during that time period.
Why are they so common during that period of a woman's life?
A number of reasons. One, physiologically, because of all the hormone fluctuations, there's increased risk because of that. And having a baby is extraordinarily challenging. So it rocks our family, it rocks our world. And because of that, we're at increased risk of experiencing mood and anxiety disorders.
What is the difference between depression and anxiety, and what should women be on the lookout for?
So I think if we're concerned that we're experiencing depression, some of the things to look out for is, one, do I feel depressed on most days? Am I having trouble motivating to do things? Does it feel harder to get out of bed? Does it feel harder to do my daily activities? And is it harder am I enjoying things like I used to? We can also see changes in our sleep, our appetite, our ability to concentrate. And also, we can often feel bad about ourselves. We may feel like we're a bad parent, or we want to give the baby to someone else because we think they're better off with them. And if it's more severe, we may have thoughts of death or wanting to die.
And what about with anxiety?
With anxiety, we often see actually increased energy, and we often with anxiety have thoughts that of worrying about things. So we may predict that bad things are going to happen. We may be worrying all the time. And often with anxiety, people can feel rushed. They can feel restless. They may feel annoyed or irritable with people, and also a lot of trouble sleeping.
And like you were saying, having a baby is a huge event in someone's life. It's life-changing, and it can be stressful for everyone. What is the point where you actually should go and ask for help versus just being like, oh, this is stressful, this is new, it's challenging, versus actually needing to take that next step?
Yeah. So postpartum blues is something that's very common. It occurs in 80% of individuals who, after having a baby. The difference is that is self-limited. It typically doesn't last more than 2 weeks, and it doesn't affect functioning. So if someone's crying, we all have feelings. We all cry sometimes. We feel sad. The difference between depression and anxiety when we need treatment is when it's affecting our functioning. So if it's harder to do things, if it's harder to motivate, if it's hard to do our activities, that's when we want to seek help, is when it's affecting our functioning and it's hard to do our daily activities.
Why are so many women going undiagnosed and untreated?
So there's so many reasons, but I'll focus on a lot of it is because, one, it's stigma, right? That people don't necessarily want to talk about this. I think another reason is that we don't think necessarily of mental health on par with medical health just yet. So when we think about high blood pressure in pregnancy, every woman is screened for high blood pressure. And if it's positive, if the blood pressure is high, then they get treatment, right? That is a core part of obstetric care. With depression, even if it's detected, it may not necessarily, it's not yet a part of care as these other medical illnesses are. And so when people say, oh, do you seek help? I would actually say, we don't expect people to seek help for high blood pressure. We know the medical community will do that. It should be the same for depression and anxiety.
That is so interesting. What are some of the treatment options that are available for women who are experiencing these challenges?
The good news is we have a lot of effective treatment options that work. So psychosocial treatments, so like peer support, peer mentorship work. Also psychotherapy. Those are for more mild illness. Although anybody with any severity of illness can benefit from those. When it's more moderate to severe, then also medication is a treatment option. Medications can be taken during pregnancy and breastfeeding. As a psychiatrist, I'm typically far more concerned about the risks of untreated illness than I am about the exposure of a medication, the mom or the baby to the medication.
All right, Nancy Byatt, thank you so much for being here this morning and talking about this and raising awareness about it. It's so important.
You're very welcome. Pleasure to be